Public Works and Infrastructure Committee meeting. I'm the chair, Chol Majuk. I'm joined by Councilor
Aaron Reich.
Aaron Wright. I can never get that.
Don't worry,
right.
I missed
I'm
it
sorry.
too the other
I'm
day.
sorry.
We're gonna get it right.
Yeah, Aaron Wright. Aaron Wright. Aaron Wright. It's one of those. Councilor Moore, Councilor Nave, Councilor Caldwell, and our president. Did you just say Bulldog?
Caldwell Bulldog, that's my name.
And President Peñawa. I'm joined by the Commissioner. Commissioner, thank you for coming. We are here today to talk about the issues around lead in the pipe, around residential, as far as the pipes. So this meeting is going to be twofold. The first part is going to talk about the testing part of the lead. The other piece is going to talk about the pipe replacement. So it's a two-piece. And what I want to do is give the commissioner the floor to run us through. We have already had a conversation and put in a request for him to outline this issue. So we're going to give you the floor, and let's hold our questions until he's done, and then we can go into discussion.
All right,
Fair? All right.
Yep, sounds good.
You want us to sit somewhere else in
Do
terms
I
of the
want you to?
screen?
No, I'm not gonna use
Same
that
thing as
quite
I'm
yet.
here.
Okay.
All right,
I'm gonna
just
give you a little update on the water sampling. So the city of Syracuse is required to do 2 semesters of water sampling a year. First semester, which runs from January to June, second semester, July to December. We have just finished our second semester for the 2025 season. We've got the results. We haven't made them public yet. They have to be approved by the EPA and the Department of Health. But they've come in under the 15 parts per billion action level, which is the EPA standards for the third testing cycle in a row. We had 120 Water do our sampling. They've done it for the last 2 semesters, the first half of 25, the second half of 25. We are now entering into a contract, because we put it out for an RFP out for it, with Trupanti, who's another company that does the same kind of sampling. The testing will be exactly the same. You'll get something in the mail, and we have to test 100 homes per semester. So you'll get we try to test the same homes, so that way we can, make sure our water treatment's working, our orthophosphate is working in these homes. And we break them up throughout the community, so they're on every different side of town. And there's tier 1 testing, which they have to be a single family home in New York State with a lead service line that meet the tier 1 criteria. Trupani won the contract. They are going to do it in the same pattern as 120 Water did. You'll get a mailing, you'll get a update, saying that the testing has begun, asking if you want to participate. Once you, say you want to participate, they'll send you a sample kit in the mail. You'll take your sample, you'll put it in the mail, it goes directly to the lab. There's no middle people touching the sample, it goes from home to lab. And then we'll get our results, and we wait till we get 100 or more samples. And at the end of June of this year, we'll have our first half of 2026 sampling done. And that's how we do our testing.
We ask questions, or you want to? Look, I'm waiting.
So we'll move to the next portion, but yeah, follow up with these.
No, I just want to, no, go ahead, just go ahead. We'll save it, because you might answer it. He might answer it.
He might?
Yeah,
Okay.
so just go ahead.
Go ahead.
Yep, go ahead.
And I lost train of thought for a minute. So that's how the sampling pool works. And I just want everyone to know, we sample our water through the homes. We know the homes have lead service lines, so any home that has a lead service line has a potential risk for lead leaching into their water through their service line. The reason why we test these homes is to make sure our treatment's working, because we have to treat our water, EPA requirements, to reduce the risk of lead leaching into your water, and that's how we treat it with orthophosphate. Right now, our sampling pool, we're in works with the EPA, and we're in works with an engineering company Cadmus Group, and they're working through Jaquin's, and they're going out right now and doing some sampling on their own to
Can you
help
say that again? Cadmic?
Cadmus Group.
Spell that.
CADMUS.
And they're going through, and we're doing harvesting, taking out lead pipes out of the ground, and they're doing the first and the fifth liter samples in these homes. And it's going to help us know what we have to do to, if we have to increase our orthophosphate, what we have to do to help us meet the regulations and requirements coming by the EPA, because the standards are gonna drop lower in 2027, from 15 to 10 parts per billion.
That's in the same footprint of these other
The testing,
100 homes that you.
these homes are separate tested homes. They have been in, a lot of them have been in our sampling pool before. They volunteered, it takes more time. This is the company themselves going to the home first thing in the morning and do the sampling. So the homeowners don't touch them at all. They'll do the sampling right in the home, the engineering firm, and that's going to help us understand what we have to do for our water treatment to give better quality of water through the lead service lines.
So do you have any, I mean, now that you're telling us this information for the public, people have a lot of concerns. What is your concern right now with this so far?
My concern?
Or do you not have any concerns?
I do not
with the
have
water?
any concerns.
So you think that?
I mean, I wish we could remove every lead service line in the city like tomorrow. You know, as a city resident, I have a lead service. I know many people in this city that have been born and raised in this city that have lead service lines. I wish we could replace them all tomorrow. Due to construction demands, there's a lot involved in replacing a service line. We're being very proactive. We haven't slowed down one bit since the beginning of 2024 doing service line replacements. And every time the contractor's finished, I give them more to do. So we've continuously went, even before we kick off our lead replacements that we're doing through the private side only replacements. So I do have concerns, but do I feel the community's at risk? There's things they can do to reduce that. That's run their cold water, use a filter, especially for people with young children or underlying illnesses. But as far as our water, the water side of things, I don't feel we have, I think we're doing the most we can. Nothing is different for us in the city of Syracuse as it is nationally. We have really quality water coming out of Skinny Atlas Lake, and we're doing everything we can to be proactive on replacing these service lines, treating these lines with orthophosphate till we can get to them. We're still giving out Brita filters. We're still doing everything we can to expedite this issue with the public.
So how much at this point have you replaced?
Rita, your mic.
I want to say
Sorry.
we are up to so we were required, just so we all know, we were required to do, once we had the exceedance in the first semester of 2024, we were required to do a certain amount of service line replacements. But we were only required to do the public side service line replacements. We didn't have to do the private side. Unfortunately, I took on more than I thought I could get done. I had full service line replacements. I didn't want to leave, when we left there, I wanted to leave no lead in the ground. So I tackled it as a full service line replacement. So we didn't meet the mandate required by the EPA to replace the number of service lines.
Are you going to keep doing full service? So I know there were some constituents that received letters saying that they were responsible for partial.
For the
So
private.
are we going to continue moving forward for the rest of them to do full service?
So there's a
lines?
letter going around now to constituents about some insurance, saying you're responsible for your private side service line and trying to get to sell insurance. We, the city, are standing behind, we're going to replace full service lines. When we come to your home to replace the line, we're not leaving until it's lead-free.
So how does that impact the budget? Because now you're replacing more than you were.
So we kind of planned on that. And that's where I was going to go in when we get to the next phase about lead
Okay,
service
so then
line.
we'll stop asking.
And about the budget and where we're getting the finances and how we're moving forward with this.
So before we move there, just for the viewers, would you define the full service line? What does that mean?
So we have a slide I can show you. So the full service line is from the water main itself to the meter in your home. The difference is from the water main to the curb stop, which is like a stop usually in the front of your yard in the city's right of way. We could shut the water on and off. From the main to the curb stop is the public side of the service line. And from the curb stop to the meter is the private side, which is residentially owned.
And you were replacing all of it up to the,
To the meter. So we are obligated to replace it all as of 2027. That will be the new EPA mandate. How we get funded for that is on us to figure out, but we are required to replace the full service line. We've already been proactive on that. We're doing full service line replacements now. We're not going in and just doing half the service, because we probably could have met the mandate if I just went in and did half the services for every house, but then I would have to go back in 2027 and replace them all, like we're going to do right now,
Yeah.
for the 2,900 service lines we have to replace, because we left the private side lead in the ground. And, just so everyone's aware, even when we replace that service line, it's still going to be a public and a private. The homeowners will own the private side service line. The city doesn't own that side of the service line. We're just going to replace it per EPA requirements.
So, quick question, do you have a plan of what neighborhoods you're doing when? Is there like a plan that you could post for people to see?
So, could you go to the next slide? So this is the plan right now. These are the areas that we're kicking off our lead service line replacement program. These are all homes that have previously had the public side replaced, and the lead was, the private side was left in the ground. The reason why we're tackling these homes first is so we can plan a bigger, because it's a bigger scale project, because you're going to be tackling the right-of-ways. You have to coordinate with, DPW on tearing up sidewalks, curbing, roads, when you do full service line replacements. This is going to get us so we can continue on when we build this bigger plan to start with these homes first, because all we have to do is work from the right-of-way to the meter, and then they'll all be lead-free homes.
Commissioner? Now, many of these homes that we're targeting, these homes are well over 100, 120 years old. So is this common, the lead, because of the age of the homes and they've been collected?
Right, so these were done in the year 2005 through 2007. They were randomly picked throughout the city so we could cover different neighborhoods. And that's why we're tackling these homes first. And just so we're all know what's going on. So when we come in and we replace, whenever it may be, all the service lines in the city of Syracuse, we're still going to treat your water with orthophosphate, because just because we remove the service line doesn't mean we remove all the lead out of your home, because your plumbing may have lead, your pipes may have solder, your faucets, older homes have old, sinks and faucets, and they could still have lead. So therefore, we'll still treat the water. We just won't have to worry about that lead service line coming into your home.
Right, and the breed of filters is not going to solve the problem until we change it, but it's used as a precaution.
Precaution. If you feel at risk, or you feel, like I said, younger children, or if you have, any kind of underlying illnesses, and whatever makes you feel comfortable. If you feel more comfortable using a Brita filter, then that's what we suggest you do.
Go ahead again. Okay, guys, go ahead.
Sure, I just wanted to commend you for thinking ahead in terms of the full service line replacement. I think it's very important that we have fully lead-free homes in the city of Syracuse. And I also wanted to say that observing the crews working in the Westcott and Eastside areas, they were unfailingly professional and seemed to really do their work well. So I wanted to just say that. Just as a metric, which again, I understand we didn't meet the requirements, the EPA, how far short did we fall in terms of numbers?
I think we replaced like 800, and I'm not sure what the number was.
1,500.
Okay, so we weren't too far off.
Right.
Okay.
We weren't too far off.
Thank you.
And then to replace the private side of it, the homeowner, what's the process to, because you have to dig, there's gonna be a hole, so you need a permission from the people that live in these homes?
That's the first thing.
How do you do that?
So our contractors will communicate with the home, the residents, the homeowner, on, schedule a time for us to make access to their basement, because we need access to the house to do the lead
I don't
service
see
line.
anybody saying no, but.
Oh, you'd be surprised. There's some we've had to, we have to log it, how many times we ask them. And if they continue to say no, then we can bypass that home.
So
I'll
if it's a
I'll
home-
still replace the private side because that's what we own.
Mm-hmm.
But the public side, if they're not going to let us in their home to do it, then there's nothing. A lot of them have like
So
beautiful.
if it's a renter rather than an owner, does that constitute a problem or?
We haven't came to that yet. Look, it's a free service line replacement.
Hey, yeah.
I would suggest taking it when it presents itself, because it's very costly.
So for the 800 that he had replaced, is that the map of where they were replaced?
That-
So where were they replaced?
They were replaced on our larger scale projects. So we were doing pump station projects. So wherever our pump stations were, we were replacing the lead service lines in those areas. So they would be Eastwood. We just did the Mosley, so
SU.
we replaced all Forest Hill, replaced some of Sunnycrest, some of Mosley, the university area. And even when the project ended and we replaced all the service lines, I kept going. I kept moving street to street to keep us actively moving on replacing service lines.
So when people, I get a lot of emails and calls from constituents concerned about our water, right? And it's very important that we discuss that and their concerns about the lead in the water. Do you think that the piping from, we know Skinny Atlas water, we know that's one of the better waters, but is it from the pipes that are traveling from Skinny Atlas, those main pipes that are leading in, are those need to be repaired? Are those the old ones?
Well,
No?
everything needs to be repaired. I mean, we got a 100-plus-year-old system, but they're not causing any effects through lead. The lead is introduced when it meets at the main in front of your home. The service line that was tied in by whoever built the home, how many years ago, is what we're looking to replace. Our water from Skinny Atlas to the front of your house is lead-free water.
All the pipes in there they're predominantly new ones, is that what you're saying?
No, they're 100 years old. Our intakes and our conduit coming from Skinny Atlas Lake's 100 years old, but they're made out of steel and cast and ductile iron
And
and,
sometimes hollowed out Adirondack logs.
yeah.
You still have
We
any
don't
of
have
those?
them anymore.
All right. Was a thing back then. So, you made it a point earlier. Are you all set?
Oh, yeah.
You made a point earlier about, replacing the public side, the private side, but by then, the piece within the home may be lead contaminated pipes. And you said that the treatment of the phosphate, that is
Orthophosphate.
or orthophosphate, with that treatment, how effective is that?
It's been used for years, so it's pretty effective. What it does is it coats the lead. So it creates like a barrier between the lead and the water. And that's why they tell you in the morning when you get up to flush your system, because you're pushing new water through your line that has ortho in it, which coats your lines. So any leaching that could have happened where your pipe sat overnight for 8-10 hours where you slept, you're rinsing that out of the system. That's what you're potentially doing when you run the cold water in the morning. You're rinsing your system and putting fresh water in, because our water is fresh from the main end. So that's why they worry about long-term, like people that go on vacation and leave their house for a week, they should come home and flush their system, their cold
Let it
water.
run, yeah, let it run, okay.
Put all new water through your pipes.
Okay, so a person that was fortunate to have both the private and public replaced shouldn't really worry much of the inside. If they have the ability to replace it, yes.
Right.
But it shouldn't be
You
as,
reduce the risk removing any lead. So we're moving a large section of it that the water sits dormant in overnight. We're removing that, so it reduces the risk of lead exposure to your pipes.
What was your projected number? I missed that. You said you fell short.
We're supposed to do 1,500 private side service
Well,
lines.
15 was
I
the
mean,
EPA
I'm sorry,
mandate. What did-
public side was the EPA mandated. That's why we all got that letter saying we didn't meet the requirement. We did 800 full service line replacements.
Oh, so you planned on doing the 1,500, not over.
Right.
So probably if you would have stuck with just the public side, you probably would have got your
We could have
numbers.
probably met the mandate. I would say yes.
But the EPA requirements are changing, so
In
we now have to do
2027,
full side, full.
Right. November of '27, the EPA requirements changed to, you have to do full service replacements.
So the changes in the testing mechanism, because 120, when 120 water, right? 120? 120?
120 water.
When 120 water was doing the testing, right? That's when we had those issues early on
Concerns.
with the concerns, right?
That's when we started
Okay. So-
using third-party sampling.
So this is why we transitioned to the true,
Because
Yes.
the council asked us, because we
To
got
go
an
look at,
emergency, we got an emergency waiver, so we could start the testing with 120 water, because that was the company was suggested to us through Buffalo.
right?
Overcharged us.
And then, once we went to 120, we did that we investigated, and we reached out to multiple sources.
Okay.
And Trupani came back with a fair rate.
So with True Fonte, have we seen the sample of their work and how reliable?
We have, they do St. Paul, Minneapolis, they do almost all of Texas. They do a lot of different places. We are going to be the first one in New York State that they are doing, because they're looking to, get into the state. They're using the same exact lab as 120 water used.
Okay.
So it's going to be kind of the same, they're going to the same lab, everything's going to be pretty much the same, except for it's just a different company.
And you have talked about 2 semesters. Have they started the work already?
They haven't.
Okay.
So we're
When is-
still
when
waiting
is that going to
for the
happen?
contract to go through law to be approved, but
Yeah.
you guys already voted on it, and now we're just waiting for the paperwork.
Okay.
But they're waiting, they know we're coming to them.
Okay. And, go ahead.
So you said that 120 was recommended to you, but I know that a lot of the lead service providers in Syracuse or organizations were extremely upset about us utilizing 120. And so I'm not sure who recommended it, but did you talk with them about the next company that we went with at all?
Talk to 120
Fonte.
Water about it?
No, like the organizations that work with lead in Syracuse.
We didn't,
Because
because
they
we put
had
it on
voiced their
RFP.
opinions. They strongly opposed 110 or 120, what is it?
120 water.
When we hired them. And I also thought that we were being overcharged, and that what was true. So I just wanted to know, did they have an opinion about
They did not.
this new company?
They did not. We put it out for RFP. We did all our homework on them. We called all their references throughout the country. And then we had a meeting. And that's how we did it.
And I remember there was a time crunch that we were going through and we
With
were.
120 water.
Right. We had to get something quickly.
Right, and the reason, they were suggested out of Buffalo, because that's who Buffalo uses for all their sampling. They've used them for years. And there was a couple other people, I can't remember who we contacted in New York, they utilized 120 water. And that's why we went with them, because at the time, we were under crunch to get it moving, because we have to meet the deadlines for semesters, which we were very fortunate that they worked with us, because we kind of got really into it late in the first semester with them. So they had to really do a lot of footwork to get these 100-plus samples out to these homes. But thank God for our public, we had a lot of participants that wanted to participate. They were more than happy to do the sampling, so it was really good. We had a great, constituents that wanted to be involved. Slowed down this last semester, because once you get good news, you don't think it matters anymore. But this is something we have to continually to do, and we look forward to working with the same, homes and same participants.
So is that gonna open up to other homes and other participants at some point?
So
You want to have contiguous testing, though.
Well, I know, but
Right, so We also added in some language with Trapani where we could do some of our own sampling, so we could test the two-family. It wouldn't count towards the EPA, our action levels with the EPA, but we could do some extra testing in-house for our own resources.
Do you think based on the water quality standards that we have right now, that we're going to have a difficult time meeting the new 10 parts per billion metric?
Well, I hope after the study with the engineering group and the EPA recommended to us that we'll get below that. I think we can.
So I want to stick around with the testing a little bit around how we help residents that we have identified are experiencing high lead levels, such as filters and you said earlier two mechanisms, filters and let your water run. How do we make sure that they are getting filtered? How do we make sure that the education is there? Because it seems like if you are asking somebody to have their water run, it seems like that's a child. I have kids in the house, right? A child is not gonna, when it's thirsty, a child is thirsty. They go for the water. They're not gonna let it run, nothing. So how are we helping the parents and the guardians to make sure that there's their education, and how are we getting them the filter that they need if there is a mechanism to get them?
Right, that's, they can reach out to the water department on our lead-free Syracuse, there's a site where they can call and request. We get it, in the beginning, we had a ton of people calling, we supplied. It's definitely has slowed down over the last year. These letters going out, picked back up a little bit of people, they got a new, notice in the mail. I don't know, as far as having kids myself, I don't know if my water ever sat for 6 hours without being used. So I never really thought about it. You know what I mean? Now that, I don't have children in the home, in the morning I turn the water on, when I fill my coffee pot, I let it run until I feel the temperature change, and then I, fill the coffee up. I mean,
So with supply based on demand, somebody asking basically, have we taken maybe extra step to maybe work with local organization? Because I thought initially, have we made sure that effort continue, or?
I go on, I have to say, I got so many meetings I go on to. Who do I meet with? I'm sorry. For the lead coalition. Lead Safe CNY Coalition. Okay. I go on all their meetings when they have them. I talk about, our drinking water. I tell them that there's still Brita filters available. They've picked them up. We've given them to other groups, organization groups, if they wanted a few, when they do their handouts in the community, we give them Brita filters. We've tried to work with them every way we can.
So you meet with Lead Safe who?
CNY.
So you meet with them?
I do. I go to every monthly meeting. I've been on their monthly meetings. When they ask me to speak on their meetings, I speak on their meetings, give them update what's going on with the water system. LaToya and I have a really good relationship with her.
So have you taken some of these filter to them and say, here you go, you can distribute them, or?
They've asked for them. I know they're doing the Dolly Parton thing, and they asked for some to give out there.
The literacy.
And we've given them, we'll work with anyone that wants to work with us, we're willing to work with them.
Have you ever thought about taking them to some of the community centers to pass out to people there?
So we haven't done that. I mean, in the beginning, we gave out 6,000 Brita filters when we had the exceedance. We haven't done that since because there's a database. We're supposed to keep track of who we give them to. Make sure you have a lead-free home. We've given them to, grandparents that have called and said, I have my grandchildren most of the time. We give them to them.
Oh, you're fine, go on.
So we've been in total participation with anyone that wants a Brita filter.
So, two things. Based on supply, as Councilor Majol mentioned, the areas that have currently been replaced, you said they were close to the pump stations. Are we doing our due diligence in trying to get those replacements to homes that have children in them?
So this is, I think this is the next step we're doing with the homes spread out through the city. That's 3,000 homes we're going to do. I'm sure there's children that live in some of them homes.
But how are we identifying that?
I can't go door to door and knock and ask, do you have a child?
And you don't have to go door to door. You can send out a letter,
Right,
telling
so-
people to send some
so-
information
so-
back. There's things that we can do.
I understand. So this is, we're talking a huge financial on the city. So for me to go to your house because you have a young child, then go 3 blocks over to do a house because they have a young child, we are taking pockets of the city and doing whole streets at a time.
Yeah, I understand that. But if we have a
So
whole
we,
street full of seniors who probably aren't at risk, and there's a whole nother street adjacent to that that has youth that could benefit from that, I would prefer that the homes that have the youth in them.
so this round of replacements we're doing right now are the private side onlys that we've already replaced the public side. So that doesn't change for us. Some homes have already been done. We're going in and because we have a grant that'll cover that whole 2,900 homes. As we're doing that, we're working on a larger scale citywide replacement, inventory citywide replacement. And a lot of that is going on, equity score, children, communities that have, more children than other communities. So we're already planning that out. It just
Think-
takes,
So I think in collecting that data, you could have done that already. When we handed out the Brita filters, we could have asked for family size information. That probably would have been a good idea, and it's not something that you can't do moving forward. My next question was, for those who already received the Brita filters, are we doing replacement filters? Is that in the budget?
we have put that out there. Anyone that wants one can come pick up a thing. We're in contact with WIC. We've been in contact with all the programs. There's not a whole lot of takers on that anymore. I can tell you this, most of the people I know that took a Brita filter, it's probably in their trash. They said took too much room in the refrigerator, it didn't taste right. I had so many complaints about the Brita filter.
Commissioner, one of the things that when we first talked about this is a couple years going in, we talked about collaborating with the school systems. Have we talked to the schools? Have we been in the schools? Have we been giving them information, making sure that, the schools, hey, even signs up to say, make sure when you run your water, you give it a few seconds before you drink the water. Those things, make sure that our kids are educated in that process.
So when we first started this in 2024, we gave Brita filters to all the schools, ages 1 through anyone that was from kindergarten to like first grade, I believe. Every city school, every charter school with young children, we gave them Brita filters to give to all the homes. We didn't look for information, whether you had a service line, we just gave it to every child to make sure every child had one.
Under age 5 though, right? It wasn't every child, it was under age.
Six and under.
But we haven't did any continual education where we're like, hey, we gotta make sure that, because it's not a one-time thing, we
Right,
can't
right.
just do that.
And we are working on our educational stuff with comms, and we've been working with the EPA on our educational stuff that we're gonna be doing, as we move forward.
So with, as you can hear from the councilors, I think the effort is there. I think the consistency is what we are pushing for, to consistently push for that education. Because I think if we can help people understand that fighting lead is not just gonna be coming from the city by itself. There's a part of it that individual need to put in, right? And that's an element of education that need to go into that. So maybe what we are saying is that it's probably important to be sending out notices, just like you do maybe when you send out a notice, maybe put in the bold letters that let your water run, pick up a filter and put the address there that there's filters. You see what I'm saying? Pushing out those education. And again, when we had this meeting initially, we had proposed that rather than just working with Lead Coalition, also try TNTs, where those community members go. Try some of the libraries, try the community centers, you know, try to push like that. And the schools, you know, consistently.
I can tell you this has been since 2024, this has been an ongoing project for the city of Syracuse. Not one person I could say in the water department staffing has rested on this lead replacement and trying to expedite it, seeking grants, seeking funding, seeking educational, working with comms every day. My engineers are in constant contact with Sol. We are in constant contact with trying to educate the public. We're sending out mailings. We have increased our budget for mailings. This has been a no rest situation for us.
So
We are making this a priority. This is like a massive priority.
And I'm not questioning the priority at all. And I appreciate you doing that. What I'm saying is the consistency around it. Like for example, around the education, around having the filters, having flush your faucet and stuff like that. How many did we send out in 2025 to people to make sure that that communication is there? How many reminders did we send out to say that we have filters available, you can pick them up here? How many channels have we had in terms of expansion, making sure that people have access? Because transportation is an issue in this community. And so if they are sitting, for example, on Northeast Community Center, somebody at the south side, that's definitely a barrier right there. You see what I'm saying? So I think the more we reduce the ability for a person to have to travel across town to get a filter, it become even more cumbersome to some people to be safe, because now they got to put in all these work that they have to find money to get bus passes and a whole bunch of other stuff.
So I don't want to say we're a delivery service, but anyone that has reached out to us and said they didn't have means to come and get one, I sent one to the home through one of the employees, or I personally delivered one to a home. So we are trying to do, anyone that calls, we're not turning anyone away. We're not telling them, no, if you can't get here, you can't have one. We're doing whatever it takes. If someone wants one, that it makes them feel at rest, we'll make sure they get it.
Okay, I think moving away from this specific topic, I think we got to figure out how to be better at education. And I appreciate the effort from your team. I think the education need to be better in terms of being proactive around it, so that when people could pick them up, because people don't know what they don't know, right?
And then language becomes an issue as well.
I had one more thing. So I guess, hearing you say that the majority of the filters are probably in the trash because of all of the complaints that you've heard. If the feedback you have, then what's your response to it? To continue to give out the same exact filter? Like, when I found out last year that it was a pitcher filter, because I had no idea that that's what we were giving out, I expressed my concern with that and why we weren't doing the faucet filter, which you stated that everyone has all of these different faucets and, we can't have like different models. I'm just gonna step out on a limb and say we need to revisit that. And if we have to replace the faucet piece for some people, then we should be looking at funding or grants for that as well. If it's just a particular screw-on type, then we might want to suggest that.
So we are under an EPA requirement. We don't have say in what we give them. This is an EPA requirement. We have to give them a Brita pitcher.
Yes, and that can be
It's
for the
EPA.
meantime. That
You know
can
what
be
I mean?
for the
That's-
meantime, because you
That's a
see now.
standard that we have to give them. Just like when we do your service line replacement now, you automatically get a Brita filter and another second cartridge. So as soon as we do your replacement, we give you a Brita filter and a cartridge. That's an EPA requirement. We're required to give these things.
No, you're required to give a filter. You decided which one that it was.
Well, because it has to be a Brita filter. I mean, not Brita, it has to reduce lead by a certain percentage.
Yes.
There's some standards.
So it doesn't have to be this picture, is
Right.
what I'm trying to say. We just need to revisit that.
We
don't
just-
have to go back and forth now
Okay.
with that. We just need
Okay.
to look at it at some point in time and figure out, the best way to deal with it. Because if they're going in the trash, that's money wasted.
I agree.
So we need to figure out the best thing.
And do we know the numbers, or are they out yet in terms of the child-led numbers for the county? Do we know this year yet, or is it too early for the
I know
numbers?
somebody here is from Community Foundation, a lead program. They're funded by chance. do you-
Anybody knows that?
That's the let's say
Can't the
CNY
lead
we're
say
talking about.
CNY, do you?
Okay, they're not out, okay.
Say that, come on.
Say your name.
Say your name.
My name is Oceana Fair. I'm from Families for Lead Freedom Now. We poison approximately 600 children per year of the kids that are tested through Onondaga County through their doctors. To put that in perspective so we can all understand how many kids that is, McKinley Brighton School holds 600 students. So we are poisoning a building full of elementary children per year.
Thank you. Thank
So you
you.
said they were tested 600? Say that again.
Of the children tested. So in Syracuse, in Onondaga County, we know we miss a good portion of children who should be tested for various reasons that take too long to go into right now. But of the children that are tested, we poison approximately 600 per year here.
Do we know if that lead is coming from the water, or is it coming from paint? Or is it a mix of both?
It's a mix of both. Our primary source of lead throughout New York State is always going to be lead paint. But we have to take into account the lead in water. Just because the action level is 5.5 micrograms per deciliter in New York State, not recognized by the CDC, which recognizes 3.5, we need to be concerned about those children who are coming in at those lower levels, which can happen through lead and water, which happened in my home that was fully remediated from lead paint. Those are more damaging levels according to the new studies.
And those that are tested, they're 3 and under, correct? Or is it 5 and
In
under?
New York State, it's mandatory that every child be tested at 1 and 2 at their New York State well child check when they go to their doctors. However, based on where the child lives, based on symptoms, based on various other factors, we know that children 5 and below are at high risk. So it is recommended that children 5 and below always be screened and then tested if necessary.
Thank you.
Thank you, Shannon.
Thank you.
For us, Commissioner, I think from the testing level, if you can keep us posted on the numbers, and then let's talk offline about the education and how we can push that. Any other questions?
Actually, if we can help you, let us know.
So Commissioner, a couple weeks ago, many residents of the north side had very little water. It was very low. Would you advise, when your water pressure is trickling and it's low, don't drink the water at all, because like you were saying, run the water for a minute and flush out the lead. When it's low, I believe, correct me if I'm wrong, there is lead in that water. And if it's going to take much longer, I think there's lead in the water. If it's not running properly, it's running very low, there's lead in the water, and I think, in my opinion, if you run it more than 1 minute, the lead's still going to be in there. Now, correct me if I'm wrong in saying that.
I don't know anyone at this time that has trickling water.
Well, we did 2 weeks ago. I got up during the night, there's water, people went on next door, and they said there was low water pressure, and I think it had something to do with Aqua, because their water pressure was low, and there were some incidents, Northside residents alerted me, water pressure was low one day, and it was very low, very low. So I'm concerned that when it's very low, it's going to be, people are going to have lead in that water, and I don't think letting it run for 1 or 2 minutes is going to make any difference. So I hope everybody knows to have bottled water is a precautionary.
Yeah, I don't know about that. I believe if you run your water and water's coming out of your spigot, whether it's low pressure or high pressure, it's fresh water. But if you have concerns, there's, like you said, there's bottled water,
Commissioner, yeah, we can't. Commissioner, I got a question. So it's an act, so I know we have, a lot of community, organizations here who represents the community, who have concerns about the lead, our children, our seniors, our family, and it's important that we connect with them. My ask from you is that you connect with them and you start having more communication, like, monthly meetings with them so they're concerned. So it's not a mix of, we think this, we know this. No, they're the voices, right, of our community. They're the ones that are knocking doors. They're the ones that are children. They're the ones that are in the school. We should be having ongoing conversations with them, even when it comes to changing the pipes. Maybe they can be a support of those ones who knocked down the door and you couldn't get through, right? To say, listen, this is how important it is, it is a health risk, right? So if we did better, these coalitions are here, I know sometimes we look at them like, oh my gosh, they're not, no, they're for the people just as well as you are. And if we can come together and bring them together and have them at a regular meeting with you so that they can get the word out, there's not a possibility where it's like, well, this is going on. They know directly what's going on and they can help be the voice of the community. I think this would be a way to bridge the community and the relationship, but also get the word out to the community, what's really going on with our water, because people have a lot of concerns with that. And I think it would be a great support and it would change the narrative with, what's going on with the water department.
So I'm a lifelong city resident. I lived here my whole life, nowhere else. Anyone that's having a community meeting, if they want me there, send me an invite. I'll go to any community meetings that invites me.
No, so I get that. So what I want to do is, and if I could be told not to step over, I want to help. There's like 5 or 4 different coalitions that work together. I know there's one that you mentioned, and then Oceana came up. There's a couple. Is there any way that you can gather and call your meeting and bring them together, right? To say, this is what's going on, this is what we're doing, these are our concerns, this is not our concern, this is what we need, so that we can get that word out to the community, and it's not a question is it going or is not going, because they're working direct, they're like, how you have the ambassadors, they're the ambassadors of the community, so that we could work together.
I will meet with anyone and work with anyone that wants to work with me.
So here's what we're going to do. And Commissioner, I think just for the sake, because this is an issue that everybody's feeling,
Absolutely.
right? And it seems like we are struggling with answers. I think if we can pull ourselves together, have a conversation collectively, and figure out the way forward. People may be able to give you some suggestion. You may be able to clarify some things for them. I think we'll figure that out. We'll take it offline from here. We'll find a way to meet together with the group and all of us, okay?
We can help
and
coordinate
and
that.
we'll coordinate that, okay? We'll do that. Sounds good?
Sounds good to me.
Okay, we'll do that. Peter King, this is a councilors meeting, but I want to make sure that since
Thank
you're
you.
standing, give you a chance. But this is traditional. We don't do that, okay?
I understand.
But since you're standing, go ahead.
Thanks, Joel. Just very briefly, I'm Peter King. I'm with some of these groups sometimes, but I just wanted to make the comment that the problem itself may not be completely understood. That I think I don't know. I don't know all the details. I don't know half the details probably, but the city may be doing everything they possibly could reasonably and above and beyond. The activists may be doing everything they think they should and above and beyond. But if the problem is not as understood, which may be the case, you'd end up fighting each other. I guess the assumption so far is that the lead's from inside the pipes, at the high lead events that you had.
Right.
Okay, that's a reasonable assumption given the age of the system. But there's another possibility that I think may be connected, say, with the Marty Nave is talking about low water pressure at times. That's something the city has had for decades. As I was reading 1970s, they're talking about low water pressure. And it's maybe just due to the shifting soils that we have. We have the kind of soils that move around a lot. If that's the case, I think we have about 20% non-revenue water on average. I mean, and again, I have a report from 2000 reporting that figure, about 20%, which means that 20% of the water is just leaking out somewhere. Now, if you have low or no pressure in a pipe, sometimes you can have these things called water transients, or it's called water hammer, say, for plumber.
30-second, Peter, yeah.
Yeah. So a water transient can pull in stuff like soil from outside, and so then that could cause a reading. And there's a way you could probably test for that, but anyway, that's my major point.
Thank you.
Thank you, Peter. Thank you. So let's go on to the numbers in terms of the financials that you have, because we are running out of time.
So the capital improvements, the Water Department Capital Improvement Plan is $25 million a year for the next 6 years for water system infrastructure improvements for lead service line replacements. We have a lead service line replacement bipartisan. We just got a bipartisan infrastructure law lead service line grant funding of $22,756,047. It's a one-time grant. That's what we're doing to kick off this service line replacements.
Do you think that there will be a clawback from that funding?
What's that?
That funding, is it safe? Or
I believe
do you
it's
think-
safe, yes.
Okay.
We were granted a federal grant for lead service line inventory for $2 million. That was a one-time grant. We're utilizing that to do our inventory. And we've utilized that in the past when we had to come up with when we had to send out our notices of, what you had for service line material. We bonded this year alone, or 2025, for $5 million, that's how we continued on with the lead service line replacements. Instead of just stopping at the projects, we moved forward and doing other areas, like we added like Westmoreland from Genesee to Euclid. We added, we just kept going down the line, replacing homes. About the testing compliance, that's $48,000 per year, an annual contract with Traponte for that. And like I said, we're still, as we're waiting for this to pass through the EFC, we're still, JJ Lane, our contractor, is still out there replacing service lines today. And just so people are aware, people that have participated in our sampling, our tier 1 sampling, if you had an exceedance, I'm replacing your service line immediately. So if you have an exceedance, we get notified from, at the time, 120 Water, I'm replacing your service line.
In English,
How many of
could
those
you
have
tell
you
them
had?
what exceed, I mean, I know, but for the people that's listening, can you tell them what you meant by that?
So when you voluntarily participating in our lead copper sampling, which we have to do the 100 homes a semester, if you participate in that and you have an exceedance, which is 15 parts per million, you're over the exceedance level, action level, we're replacing your service line for you.
And how many?
Then you'll be removed from the pool because we can't test you as tier 1 anymore because you've had a lead service line replacement. We had 4 exceedants in this last round of testing. I believe we only had 100 participants in this round of testing. We had 20-something people that never returned their kits.
Was that in the Meadowbrook area? Or where was this at? In what neighborhood?
This is the whole citywide.
So there was only 4 the whole citywide?
4 citywide exceeded the 15 parts per million action level.
So you said about 20 people didn't return their kits. We're still having the resident do the testing themselves?
The resident, that's an EPA requirement. The resident has to do the testing. We can't go in the home and do the testing. They have to fill their bottles. There's directions on the bottle. They fill it, they put it in the mail, and the mail carrier takes it to the, delivers it to the lab.
That's EPA required.
That's a requirement.
Okay.
We have a hard time getting 100 participants. We definitely wouldn't get 100 participants if we had to be in your house at 6 o'clock in the morning to draw water before you use your toilet. We wouldn't have 20 participants if we had to do it ourselves.
So Commissioner, the $25 million, was that just for the 2025?
No, the $25 million, put into our capital improvement plan. That's for the next 6 years, 25 million.
Okay, so it come down to what, about 4 million?
Six years
million?
would be 150 million, 1.5 million.
Okay, so with that, what did
Right,
we
maybe,
spend this past year on
What did-
replacement?
This past year, with the projects, because I can't really tell you, because it was, a lot of the projects were involved in that.
Out of this, yeah. What did we spend?
This is the 2026 capital improvement plan.
Okay. And then in
Previous years
2025,
were all our projects that we were replacing off of the $5 million.
just the pipes, just the replacement of pipes.
Well, we were replacing any new water main we replaced the service line hook to that water main. So, and then we continued on in areas we weren't replacing the mains. Because the initial message when we started these pump station projects, we were doing all the service lines in these areas, and that was kind of a mixed message. But I made sure we went back and replaced them all that were in these areas.
So if you had, if somebody in the community is asking you, Commissioner, from a 360 view, what's your plan of replacing this in a nutshell? What would you say?
I would say we're going to do it as fast as the city that we can. I hope it doesn't take the required time the EPA is giving us, which is, from my understanding, because of the size of our city, it's a 10-year mandate on it nationwide, but the more service lines you have, the longer you have. I believe we may have 19 years to replace them all, and I'm going to say we're not going to take 19 years to replace those service lines.
So out of the 1,500 and you got 800, how many service lines do you have to replace? Because you said this,
Citywide?
yeah, the EP,
So,
the EPA wanted 1,500, you only did 800.
Right.
Out of that 1,500 combined, how many are left?
So we have about 14,000 known service lines that are known lead, whether it be, so that might be just a private size lead, just a public size lead, but we have
14,000.
14,000 known. But we also have about 16,000 service lines in the city that are unknown, that we don't know nothing about. Because if you look at the mapping, a big portion of unknowns are in the Eastwood area, in the Salt Springs area, because they weren't part of the city at one time. When them homes were built, they weren't part of the city. So we don't have a lot of records on their service material.
So
So that's what our engineering team is doing, help us develop a plan to figure out these unknowns.
So specifically, out of the 14,000 that are known, through the effort, how many have we replaced out of these 14,000?
Probably 1,000.
Probably 1,000.
Right. That was 800 from 2025.
Yeah.
We replaced some in 2024 too.
When did we know these 1,400? When did we identify these, that they were lead service line? And then when we
It's been a few years since
and then we actively start replacing as of 2025,
2024.
2024. So out of 2024 to 2025, we replaced 800,
Probably 1,000
1,000.
from 2024.
Could you
from probably
find those numbers and give them to us?
I can.
Yeah.
How many
That'd be-
service line
that'd be great.
replacements we
Yeah.
did.
Okay, I just gotta clarify something with that. So last year, you said that you guys had already done, I thought it was like 2,700 or 2,400 replacement lines, and that you were gonna go back to those and do the, private side. So is that number included? That apparently is not included.
That is the map right there. We haven't been to them homes yet. So you're talking spending $22 million. It's a big process to spend that money. It's just like, if I could go out and hire contractors tomorrow and say, go in and do it and attack it, I would do it. You have to draw up contracts, you have to put it out to bid, it has to go through law, it has to go through the EFC to make sure
Okay,
our
so
plan.
wait a minute. So,
That's
Out
should be
of
kicking
the-
off like right now.
okay, so the lines that last year you said you were going back to, what was it, 27 or 24?
The lines that we're going back to, it was like 20, right around 2,900 lines.
Okay,
Service
2,900
lines.
lines. So The ones that you recently did, the 800, none of those were
None
of
of
the
them
ones
were-
that you said last year.
They weren't included in the 2,900. That is still in the EFC's hands. We were hoping to already have that started last year, but there's a process. So that's, I believe EFC has it right now, making sure this plan is what they agree on, and.
What's
that's
the EFC? I'm sorry.
Environmental,
Finance Center.
yeah, what's,
Environmental Facilities
yeah,
Corporation,
yeah.
EFC.
New York State.
And we didn't catch, what's your role?
I'm Ryan Dort. I'm the Water Systems Construction Engineer.
Okay, good to meet you.
Meet you too.
You know, and Council, are you done?
Yeah.
Okay. Councilor Joe Rouser touched on a very important point, which is your struggle as a commissioner on the replacement. You got $25 million coming up. You got the limited amount of resource we have, we put them at your disposal. What's the struggle? Just so that we catch that again. Why is the replacement not happening as fast as we would like?
Politics,
Politics, one, okay.
that's what the holdup is.
Politics in the building or out?
Or just, you know, through the, getting it done, you know, everything's.
Is it us?
No. Just saying, just the whole, like, the process. It's gotta go to law, it's gotta go to, you know, we had to go to council.
So
put
the
it on
bureaucracy, not the politics.
Yeah, okay.
Yeah, that's the word. Right,
That's
right.
the word.
The
Bureaucracy.
process.
There you go.
Yeah.
There you go.
Yeah.
I mean,
You got us kind of feeling
Yeah,
sometimes.
wait a minute.
I'm on that side, so. But what I want to say is this: we have been proactive in this. You got to remember, this is a national problem. So we've been proactive. So we went out when we bid these contracts. We could have said, let's just put it out of 2,900 contracts and see what contractor has the biggest funding and can come in at the cheapest price. And we didn't. We broke it down to bring in more contractors. So we can, once we get them into the city working for us, we're hoping to keep them here. Because come 2027, the whole country's looking for contractors to replace the service lines, because they're not gonna have a choice. So we came out with phase one of this service line program. So with the private-only side, we bid that. We had 5 contractors come in for the pre-bidding. I believe we had 5 contractors bid on them. We awarded them to 2 different contractors. We rewarded contract 1 and contract 2 to 1, and we rewarded contract 3 to 1. So now we have 2 contractors in here. But the good thing is they all sat in a room together, so they all know what they bid. So now we're gonna put out phase 2 and try to draw in more contractors. So once we have the contractors locked into the city, we're hoping to keep the work moving so they don't leave, because the competition's only gonna get bigger come 2027. Because you're talking Chicago alone has like 400,000 lead service lines in one city.
And financially, it works better too, right?
So, right, the more competition we have in the city, and they definitely came in at better rates than we thought they were gonna come in, because there was more people in the room. And that's what we're doing. We're planning to get more for the city's dollar.
You have somebody, I know when we first talked about this, maybe 24, 23, you were hiring someone to follow JJ Lane and follow the contractors and make sure they are doing what they're saying they're doing. Are we still
So we have-
checking and balancing, making sure the
We have a
contractors?
construction manager that's out there checking on them. We have, our engineering firm has people out there watching them. And when this project comes off, they're gonna have 2 field representation out there watching, because we're gonna have a lot of work going on at one time. I mean, we're hoping that they can knock this many service lines off in a year, which is pretty fast paced. That's 2,900 homes they have to go into. You know, it may not be a year, but we're hoping the faster we can go, you know, and these are large scale contractors, so they can have multiple crews out there. It's not gonna be one guy digging a hole and doing a service line. They're gonna have 5, 6 crews each doing homes and just trying to be proactive and keep going. And by that time, when they finish this, we're hoping to have more contracts come out saying, this is the next phase of the plan.
So for purposes for people, like you can look at the map
Sheeta,
and,
you're hitting two mics. Could you just move that one over?
oh, I was echoing. Sorry. So for the purpose of the people, is there any way on the city's website we can break that down in by streets, right?
Yeah, I think we have that. We could
Is it
send
on the
to you.
website, on
I
streets?
don't think it's on the
Like,
website.
We requested for sidewalks, it should be like, this street, right, we're coming to you, like, there should be street names, so if people looked at it, they would know that that's what's next instead of dots.
I don't know if that map is on our public website.
It should be. We can do that? Yes. Okay. I think that would help out the community.
Yeah.
So if they looked at it, if there's projects going, they see, oh, wait a minute, they're coming in my neighborhood. This is what expected, that they can see it on the city map instead of someone knocking on their door talking about they're gonna do work and they're like, wait a minute. You know, people are reluctant this day.
So we put in the contract this time, because we know how it is, public communication,
Mm-hmm.
that they have to send out like mailing that they're coming and try to make, some initiative before they just knock on your door and say, hey, we're here to replace your service line.
Mm-hmm.
Because it's a lot of coordination. Someone has to be home, so that's someone taking off from work.
Mm-hmm.
So we made it so they have to do a little more public communication as well as us.
Does this go through the same construction permits as every other construction does, or is it somehow different
This goes through the same thing,
process?
I believe.
So how long does it take you to get those permits?
So this one won't be as detailed because they don't have to do any digging in the right of way. They shouldn't have to dig in the road or anything like that. That's why we did this, so they can work through the winter. Because it's only from your right of way in your yard to your home. So there won't be any like permits for like road restoration or anything like that. But I believe they would pull like a large scale permit.
A large permit, okay.
So,
I just wanted to touch on language barrier. I know it was mentioned earlier, but for some of the properties that may not have sent back a sample, or if you're not receiving information from residents, is there a possibility of language barrier? Have we gone directly to the property to find out why didn't they send what? Like, is that sample bottle being mailed to them, or someone's dropping it off, so we can identify if there's a possible problem?
So the first round, we had 120 samples come in. So 120 people participated in the first half of 2025. We sent them all to the exact same people. So they've already sampled once. I'm reaching out to people and saying, hey, could you turn your sample bottle in? Oh, it's on my counter. I was good the last time, so why do I have to do it again? That's what you get, because, I didn't fail last time, I got good. And they're not participating just because they don't think the importance of it. So I'm reaching out to them, explaining to them the importance of being consistent on testing each semester, because that's how we know if our orthophosphate, if our treatment is working.
And the EPA says that they have to be the one to mail it. It couldn't be, okay, we give this to them and we hire somebody to come grab them, and then it
No, they
says
could
on there.
They could send it have someone bring it to the mail carrier.
No, what I'm saying is, it directly says that it has to be the owner to the mail. Is there anywhere in there where it could be someone, because we need the numbers and we need to make sure we get it. So is there any wiggle room where it could be, okay, the owner does it, there's a company, somebody comes, grabs it and mails them, like pick them up?
There's a possibility of contamination
Right.
and
It's a chain of command. So there's
you
a
want it to
chain
go
of
directly
command
to the
letter.
lab.
Well, it doesn't go directly to the lab, it goes to the post office. That's what he said.
Right, but the post office
Knows how to handle it.
theoretically doesn't have an interest in what the numbers are and
Right,
isn't
but
going
the
to
process
contaminate the
is no one is
sample.
getting it to them. So if there was somebody that they knew, like, there's a process. People gotta go to the post office and send it. There's a process behind that.
The 120 people that received it participated, so they know exactly what it is because they did it the prior
Right.
sampling pool. Most of them I reached out to just chose not to do it again. I didn't have time, I was out
Right,
of town.
exactly. It's another set for
And they,
people who are
right, and
already
it was no,
stressed out.
and they passed,
And I think that's where
it wasn't no big
Opportunity,
deal.
man.
that's where you have either your local community organizations
Absolutely.
or your council, and you can reach out and say, hey, this property, we weren't able to get the sample back from them. Is someone from your team, or are you able to go out? If it's my district, I want to know that. Because I can either contact Oceana, who's also in my district, and they can go out to that address, or I can go out to that address and say, hey, we really need this information. can you do it by such and such time? So,
And that's all I was saying, not the fact that contamination part, that there has to be somebody else in between that can help make this process out. Because it's important that we get the numbers, and if people, with enough, people have a lot of stuff going on in their life, in the world, so that extra step is not probably that they don't want to do it, it's just another complication that, oh, wow, I got to do this and I got to mail it. You know what I mean? It's not that people don't want to be helpful, but if we join forces with a
We'll
coalition.
take
or
any
something-
help we can get,
Okay.
because we just want it done.
Let's make that happen.
We are pressing on time. Here's
beyond
what we're
time.
gonna do. We promised earlier that we are going to call and coordinate a collective meeting where the community organization, yourself, couple of us, probably, Kevin Henry, thank you, Kevin. Kevin is our person that is, through the executive level, is sitting over DPW, right? Yes, so he's probably gonna be there. And we're gonna have this collective conversation, and then within that conversation, we will try to figure out from the community side what is working, what is not working, from the constraint on this side, and then have that, dialogue among each other. Because, we have the little bit of money we have. What hurt even more is that this little bit that we have is not moving fast enough so that we can exhaust it. And then when we get to a position where we say we can't replace this, it's because we don't have money. I want us to reach at that level rather than saying we are experiencing all this level, but we can't move fast enough to get there. You see what I'm saying?
I agree.
So we got to figure out this bureaucracy that is blocking everything. Right?
That's the word. I wrote that down, so I can remember that next time.
We got to figure that out, and collectively, hopefully in that meeting, we'll be able to get somewhere, and internally, we'll be able to do some work to get there collectively. All right?
Counselor, I had Nader get all everyone's emails and stuff so we can help collect and make this happen.
Yeah. Okay. All right. Anybody with anything pressing? No? We want to thank all of you for coming. Commissioner, thank you so much.
Thank you.
That will end our meeting. Have a good day.
Thank you.
Thank you.
All right.